Hmm. I wonder. I wonder if we make a video with maybe Jasmine and Shelby and we talk about, let me think here. We talk about CPR, pit crew, kind of the pros and cons, the things that they need to concentrate on really to be good as a team. I wonder if people had watched that. I mean, this would just be for EMTs. I wonder.
So let's talk about pit crew from BLS standpoint.
Got it.
So how do you think we do with pit crew now?
I think we're okay. I definitely think there's always room to improve. And I think that if we don't know why we're doing the things we do, or if we don't have feedback on the things that we do, we can never improve.
That's true. So I had an opportunity recently to do some scenarios with some of our really strong crews, and we do a good job with pit crew. I think above and beyond a lot of places, but there's always room for improvement. So we focus on time on chest and minimizing any interruptions. We talked about this recently in continuing education, but from a BLS standpoint, what do you think? What do you think EMTs can do when it comes to pit crew to make improvement?
For starters, I think the most important thing is to understand why we do what we do. And with teaching a CPR class almost once a week for the SunStar side to recertify our clinicians, if we don't have the basic fundamentals and if we don't know how to do the basics, then all of the advanced things that we do are not going to be beneficial.
Yeah.
So really making sure that we are in our targeted depth of at least 2 inches, at least 60% of the time, which is the AHA standard. But with having good pit crew, we can achieve that almost 80% of the time.
Yeah. So it's really important that we fall right into the correct position, so we put our equipment in the right place, and that you always have eyes on that chest and make sure that that CPR quality is there. So what are the 3 spots that an EMT can fall right into when you get on scene?
I think when an EMT gets on scene, the most important thing that they can do is go right to the chest. By having an EMT hop on CPR, that frees the hands of a paramedic, which then allows them to maybe do an advanced airway, maybe go to the IO site to administer drugs or medications. So I think going straight to the chest and hopping on CPR, so either the left of the patient or the right of the patient.
Yep. And you can fall to airway or documentation. If there's a lot of hands on scene, there is always that documentation spot. But if it's just 2 EMTs on scene starting out the call, then somebody can be bagging and the other person can be doing chest compressions. Just make sure you swap out every 2 minutes and keep your eyes on the chest and make sure there's not interruption. So what are some of the things that we can do when switching compressors or charging the monitor to make sure that we don't have an interruption in chest compressions?
Hovering the chest. I think that's really important. So when you go to do your pulse check rhythm check and to allow your AED to analyze that rhythm, we can hover over the chest, which then allows us to not be too far away from the chest, which then would allow us to hop right back onto chest compressions to make sure that we achieve that good chest compression fraction.
Yeah, and communication. It's very important to make sure that you're communicating with the person what's going to happen next. So if you're switching from one compressor to the other, it can be a tap, it can be, hey, closed loop communication. I'm going to be the next one compressing. Okay, so-and-so is going to be the next person compressing. After this cycle, when I hit 30 the next time, we're going to do a rhythm check and this person's going to tap in, I will hover. Just make sure you're communicating really well. The team working together and communicating definitely makes things go more smoothly.
I think another thing to consider as well is we can be doing chest compressions while the rhythm is charging up to do a defibrillation. So I think a lot of people forget that and they will follow the prompts and let the AED tell them what needs to do, and they just kind of sit there and listen to what the prompter is saying, and to remember that we can be doing chest compressions while the AED is charging.
Those are all really good points. So just take a minute. We're going to drop in this image here and make sure you know the roles when it comes to pit crew. And when you get on scene, make sure you fall into the appropriate position. And if there's a lot of hands on scene, take that time. If you have free time to be watching the chest and make sure that there's no interruptions in CPR. Basically CPR watch, you want to make sure that they're hovering the chest and that somebody's always on the chest. If the patient's being moved, that somebody's continuously doing compressions so that you don't have that interruption. Also, make sure that you're communicating well with other people around you.
Remember the basics. If we can't do good chest compressions, if we do not have early defibrillation, that is the 2 biggest thing that saves people's lives. Activate the emergency response system, which is us, right? Good bystander CPR or performing good CPR as soon as we get on scene and just applying the AED as soon as we can. That is the 3 things that save patients' lives. If we can't get those down, then all of the advanced skills that we do are basically fruitile.
So, in closing, make sure you know your pit crew, keep eyes on the chest, and the little things that you can do to take us from good to great to make sure that we don't interrupt chest compressions. Make sure that you're watching those things on scene. Fall into place, put your equipment right where it needs to be so that you don't have to have time off the chest or look around for things, and communicate well with the people around you.
So basically, it sounds like you think communication, good basic life support, and just making sure that we have somebody who's verifying that somebody is doing good chest compressions at all times.
Yeah, so we have CPR feedback device for that. You always keep eyes on that screen. Make sure you're doing what you need to do when it comes to depth. You said this, quality. Yeah.
At least 2 inches. The AHA states that a CCF of 60% is good, but 80% is often achievable with good teamwork and good communication.
Would people watch that? Maybe they would. Probably not. Yeah.